Hi everyone. I just want to make a little video, I guess, of sorts to kind of let everybody know like how this surgery is. I had a total thyroidectomy. It was October 5th. As you can see, my lovely scar. I had to get it removed because first I had Graves' disease, and then they found out that they found a nodule on my thyroid, and they did the biopsy, and it came back that it could be cancer. So that was more of a reason to get my thyroid removed. So had the surgery, got it all removed. At first I spent 2 days in the hospital recovering because it took a while for my calcium to come back up. And once you get your thyroid removed, either they take out all your parathyroids, or they might take out one or two. I guess you have four in your sitting either behind or in your thyroid. But I had four, and they just took one for biopsy. And they get bruised, so they take a while to wake back up and start working again to regulate your calcium. And for me, it's been pure hell trying to keep my calcium levels up. At first, I spent the 2 days in the hospital to get my calcium back up, and once it was up to where it needed to be, they released me. And then it seemed like just about every other day I was back in the ER because my calcium levels would drop and my body would start getting really numb and tingling, and it was really scary. Bad anxiety, just it was terrible. And then last Wednesday, we were on the way back up to the ER because I was feeling bad, and it was so bad that it felt like my whole body was going numb. And it was very scary. I honestly thought I was going to die. Like I wasn't going to be able to breathe, or my heart would stop or something, but it was just very scary. So when I got there on Wednesday, I told them flat out, I want to be readmitted back into the hospital to make sure this doesn't happen again to me, because one, it's about a 20-25 minute drive back up to the hospital where my surgery was at, and I didn't want to go anywhere else because they hadn't been treating me anywhere else for this. So yeah, it would be that long of a drive, and just having to deal with that, with the whole body going numb again, I didn't want to do that. So they agreed and they admitted me, and from Wednesday till Sunday I was there in the hospital. I actually got sick a little bit too, so I wasn't eating very well. I had bad, stomach pain, nausea, could barely eat anything. I was just eating like broth and crackers. That's about it. But the hospital did take very good care of me, and on Sunday I was let go and was able to come back home. And now my primary care provider is definitely keeping up with checking my blood levels, making sure the calcium is going up, and for now it's stable. And so it's not too normal yet, but it's getting stable, and my parathyroids are starting to wake up back up, so that's good. I don't. Only thing else really is, my neck is still kind of sore, but I have a nice ice pack for that I got from the hospital. I just find that it's hard to sleep on my back. I used to love to just, go to bed, lay on my stomach, and I could sleep fine that way, but now I have to sleep reclined up on a pillow, and I've been sleeping out on the couch, or else I start coughing, I think I still got a bunch of crud in either my throat or my lungs or something. So I've just been dealing with that. I'm just kind of nervous. When I did get the thyroid removed, they said that all the cancer cells were contained in the thyroid. So hopefully that, is a sign that it's not going to spread anywhere, or I'm going to have to go through this again. I keep seeing things on like Facebook and whatnot of people like having to go through this surgery like 3 times or more, or the cancer spreads, and that's something I'm pretty scared of. But most of the doctors and my husband, assures me that they don't think that it will come back. So I'm just gonna, try to keep positive, keep going on. Hopefully soon, within the next week or so, I can go back to work because I need to make that money. Other than that, if anybody has any questions, feel free to ask, and I'll try to answer the best I can. Maybe I'll do another video in a couple days to, let everybody know how I'm doing, how the recovery's going. I just want to make this video to help others that are going to have to go through this surgery, so they know kind of what to expect, what to deal with. So, go ahead and subscribe, comment, whatever. But I will make another video soon. Thanks. Bye.